Hi, this is Dr. Jason West, and welcome to New Frontiers for Health. This presentation is on Lyme disease and understanding Lyme disease. I gave this at the Utah Lyme Disease Conference in early 2011. There's been so many requests for this video or the presentation that I decided to put together on our website, lymefighter.com, and this is part one of a series. So we wanted to discuss and understand Lyme disease. It's a controversial illness in the history of medicine. It's the fastest growing infectious disease in the United States, and is quickly sweeping across the country and is referred by some as a medical tsunami. So who has Lyme disease? Lyme disease now infects more people a year than HIV and AIDS, and the diagnosed cases are increasing at a rate of nearly 50% a year. The CDC estimates that actually the numbers of those infected each year is at least tenfold of what is documented, and it's a devastating illness with consequences of those who do not discover and treat it in its earliest stage. The faster we can identify and know that someone has Lyme disease and initiate the appropriate treatment, the faster people get better. So a lot of times patients ask me, what exactly is the Lyme disease and what does it look like? So I went through the web and I found some pictures of the spirochete, the bacteria that causes Lyme disease problems. So a couple pictures of the spirochete and then the spore phase, which we'll talk a lot about in detail later. A little bit about me: I'm an alternative medical practitioner. I have a doctorate as a chiropractor. I have a second doctorate as a naturopathic medical doctor. And in my state, I'm licensed in both healthcare disciplines to provide healthcare. So I'm an accidental Lyme's doctor. I didn't start off meaning to treat Lyme disease, but I had a patient that came in that we found that had Lyme disease. We initiated an aggressive treatment. It took us a little bit of time to get her working and get her basically body balanced. She's made a miraculous response, and it's spread like wildfire. So I've had to become educated myself on Lyme disease. So the number of Lyme disease cases in the United States has doubled since 1991. And when we say doubled, I think it's been here longer than that, but that's just when we've been able to diagnose people. The CDC again estimates that there are nearly 325 new cases each year, which means that Lyme disease is an epidemic larger than AIDS, West Nile virus, and avian flu combined. It's only a fraction of those cases that are being treated due to the inaccurate tests and underreporting. And each year, hundreds of thousands go undiagnosed or misdiagnosed, often told that their symptoms are all in their head. So a lot of patients are asking me, why haven't I heard about this? Well, the media is silent because doctors and insurance companies alike dismiss it as a hypochondrial illness, just as they've done for years to sufferers of fibromyalgia and chronic fatigue. There's a lot of doctor disagreement. When there's a disagreement, the insurance companies don't like to pay claims. It can be expensive to treat. Untold numbers have it, and there's no protocol that's completely effective for all patients, and no surefire cure. And this is important. There's no one diagnostic test that's 100% effective for Lyme disease, and there's no 100% effective treatment. You have to take each person individually and put together a protocol that's going to balance out all of their systems. So it's not a prescription deficiency disease, although in some cases it may be appropriate and helpful. I love this picture that shows the conflict, the misunderstandings, confusion, egos are pitting doctors against doctor and prompting insurance companies to deny medical claims at an alarming rate and leaving suffering patients that are stuck in the middle. There was a Lyme disease task force in Virginia, and Michael Ferris, the chancellor for Patrick Henry College, stated that Lyme disease is dramatically misdiagnosed and there is too much denial by doctors that chronic Lyme disease does not exist. This is a research study that comes out of PubMed. Dr. Klaus Kurtenbach. We know that Lyme disease cases are continually rising in the United States, and the numbers of new cases in the United Kingdom appear to be increasing as well. This comes from the Bureau of Epidemiology in Utah. What is Lyme disease? Who gets Lyme disease? Utah does have cases of Lyme disease. Utah does have tick species that carry Lyme disease. This is from KSL in March of 2010 about Lehigh residents concerned over the rise of Lyme disease cases. And so when doctors say there's no Lyme disease along the Wasatch Front, I think that they haven't evaluated all of the data. This is what the Lyme disease bacteria looks like. It's a corkscrew-shaped bacteria called Borrelia burgdorferi. It's a spirochete. And we'll talk a little bit more about Lyme disease, how it can be evaluated, and what treatments are available in our next session. Again, this is Dr. Jason West, and welcome to New Frontiers for Health.